Hi, I'm Tyan Clark with Zion's Edge Massage. Today I'm going to show a full body Gua Sha treatment that you can do on yourself at home. Gua Sha is one of my favorite modalities to use because it can do all types of things like get rid of chronic pain, get rid of chronic injuries, and help with different things as far as health goes. People that suffer with fibromyalgia or other chronic conditions, chronic fatigue. Gua Sha can be amazing for you to manage all of these things at home. If you're an athlete, I would definitely recommend doing this on your body as much as you foam roll, and hopefully you do your foam rolling. So I want to show what that looks like. I use a couple of tools. Now this one I bought for, it was probably about $17, maybe $20. You can get them on Amazon. I do sell some in my studio. But I like it because it's agate is the stone, and it has smooth, kind of a thinner edge, which helps me to really get in there. There's all types of stone that you can get, but this is my favorite. The other tool that I use is the steel bar, and I got this from, I think it was called Gua Sha Space or Gua Sha Shop on Amazon. And I like this particular bar because it has, again, more of a thinner edge where you can really get in there and release adhesion. So let's begin. I want to show you what you can do on every area of your body with the tool, okay? So you get a good amount on there. I like using coconut oil because it can be used as a moisturizer as well, so it's not going to feel gross or thick on your skin. Okay, so you get your tool. And you can go in different directions, really, and you're going to take this and go at a 45-degree angle and do like kind of a scooping up motion. If you've ever been to a physical therapist and they've used Graston, which will look like some of these tools, they tend to do a full sweep up the leg. This is how I prefer to do it, and this is how I was taught. So I'm coming in here on the tendons in my soleus, going into my gastroc, which is your two different calf muscles. The good area to do in here is where these two meet, right here in the middle. You're typically going to have some adhesion going on. I'll turn so you can see this a little bit better. So if you're using your little tool, this is what it looks like. I hold it like this. And you can dig in there pretty deep. If you feel some adhesion in there, you can go in and get rid of that. If you're doing this just as a daily treatment, you don't have to dig as deep. You can do more of a broad motion. And see how I'm getting some redness right there. Hopefully you can see that. That means this area that I am in needs it. It's kind of like a little cheat sheet. And so when you hear, some people have this more than others. I have it a lot where there's areas in my body that have really dried up fascia. And that's somewhat from being an athlete, somewhat being from just not taking care of myself. And so you want to go till you can feel it smoother. If you have really thick areas, you may not be able to, you'll have to do it in like layers. So if you're going to use the bar, see how much more I can get in there with this. And again, it doesn't take hardly any effort to do that. Okay, so that's what it would look like on the calf. You can do up here on your shin. Just a little bit more oil. And you can even do all the way down on the top of your foot. You know, some of us have adhesions everywhere. A good thing to do is to do this in different directions. So you can go up, and then down, and then you can come back up on every muscle like this and do like a diagonal one way, diagonal another way, just to kind of break up all those adhesions in the different areas. And it is really good when you're done with an area to go through with your fingers or a foam roller and kind of teach your fascia and your muscles to reform and perform in the right direction. So up on the thigh, I already have a little bit of bruising because I did this on my legs last night, and I have a lot of adhesion in my quads. Most of you won't have all that. You do want to be careful about going too deep and doing it too much. If it's starting to really hurt when you're in there, you might want to do it in layers and back off. Some of this will hurt like the whole time. So again, layers, being patient, not trying to get all of it out of there at once. The best thing to do is to do Gua Sha when your leg is when your muscle is in a stretch position. So I'm not going to get as much out if my leg is relaxed like this. So I even like to sit on a chair and have my leg hang down. And you can get up here and get into these areas that really get stuck, especially if you have IT band syndrome. Getting up here, going across the knee. I will typically spend more time than this. I just want to do this for demonstration purposes. You can go up here. This is where your quad comes through. If you have knee pain, these are the areas that you want to do this on. Okay, so then we're going to follow where the quad typically gets stuck. You do want to do the whole quad, but there's a couple areas, especially right here. If you have inner knee pain, if it feels like if your knee gets stuck, or if there's or pain in this area in general, or if somebody's told you that your meniscus is probably torn, without knowing for sure, or this is a good area to do. So you can do this area. You can come over right by the IT band and kind of pull away on the quad. And I wish you could hear this, but I have that really dry, gritty sound. This is pretty common in this area, especially with athletes. If you're going to use the bar, same thing. The other fun thing about the bar is that you could sit on a chair with this and then do some active movement while you're actually scraping. So you could lift and lower really, really slow. It helps reach some of those different muscle fibers. And you can do this all the way up into this area. Not really focusing too much being right directly on the IT band, but more the areas that are on the sides. So it gets stuck to the hamstring, the muscle in the back of your leg, and it gets stuck to the quad in the front. And so this is the same thing when you're foam rolling. So you're trying to release those adhesions, and a lot of times they're kind of deep, but typically you're going to find them in the middle, down there, and up here. And then going onto the back of the leg, doing the hamstring. This is one of my favorites. You get a lot of leverage doing it with this tool. These are a little bit more expensive. They're about $100 each, but in my opinion, they're well worth it. If you search Gua Sha tools, they're going to be cheaper than things that are advertised to Graston, and that's Eastern medicine versus Western medicine for you. Okay, so getting all the way up, you have hamstring problems, you can get all the way up into this area where it adheres to where it inserts into the glutes, up on the ischial tuberosity. All right, so, and the other part on the foot is, you can do the bottom of it, and you probably find that you'll be fighting pain and ticklishness. But if you do it on yourself, it's a lot easier. It's a lot easier to handle. But you can really dig in there. If you have feet pain, this is really effective. Okay, so moving up. So you can do this on areas I'm not particularly going to show right now, but you can come in here and do it at the top of your hip. This is a spot that really gets stuck in a lot of people, especially athletes. People that sit, have sedentary jobs. Getting up into your, it's called your glute medius. That's a great spot to target. Coming down here, again pulling these muscles away from the IT band, which comes all the way up. And it's a lot easier on skin. It's not really going to work over clothing that well. All right, so moving on, I like to do Gua Sha a lot on my arms because I'm a massage therapist and they just need lots of work. So again, using oil. This is one where the bar is not really going to work, so that's why it's nice to have this smaller tool. Again, moving from with a dipping or scooping motion. I don't know if you can hear that. That's some fascia that's really hardened on me. Moving in here. On your forearm, if you have something like carpal tunnel, you typically get adhesions in a couple areas. There will be one where you have your flexors and your extensors. These are extensors, these are flexors. They flex and extend the wrist. And if you go in between them, they commonly get stuck together, and you can feel this little line in here. So you can come in here with your tool and try to separate those two. And the same thing on the other side. You'll feel it right here. So you'll spend some more time in there. Maybe I should show how long I would typically do this. If you start to get raised bumps on your leg or on the skin wherever you're at, it's done for now. You probably just want to leave it at that. And you don't want to do Gua Sha more than a couple times a week because your body does need to heal after. Areas that you have more fat on your body, like your legs, may end up coming out with some sort of like bruising, and that's usually just the fascia because it's been so stuck for so long. It does bruise a little bit, but it's totally normal to see that. I like to do Gua Sha a lot on my biceps and triceps. If you have any sort of tennis elbow, golfer's elbow, pain in here, you'll really want to get into your triceps. And again, focusing on the area where the triceps and the biceps meet, you can feel that little line down the middle. If you're somebody who suffers from chronic fatigue or fibromyalgia, you'll probably find all these little areas that I'm talking about will definitely have some of these adhesions. And after you've scraped them, you'll feel that you'll have more energy or less tiredness. When you're starting out though, it may cause a little bit more fatigue, and that's totally normal, but just remember that it gets better. See how I'm getting redness here? I work on mine a lot, so they're feeling pretty good nowadays. And going up into the delts or your shoulder muscle. Okay, and there's one more area that people really typically have a lot of adhesion, and that's right here in your pec major, pec minor, going into the biceps, so your chest muscles going into the arm muscle. This is an excellent area to do on yourself. And again, you want to kind of have it at a stretch. It's a lot harder to scrape like this. I could feel it a lot more in there. You probably will get some nice redness going on. This can cause different things like upper back problems, because when this gets tight, let's say that you have a sedentary job, a lot of times it can pull everything over like this. And it makes this back here, neck, upper back hurt a lot more. And then also, if you have shoulder problems, this is often one of the causes. So a good one to do. It's hard to get to your own back. You can't really do Gua Sha on yourself there. You're going to have somebody else do it. Going on into the neck. definitely can do this here. The neck is one of the biggest offenders of having chronic tightness, having those fascial adhesions. You know, if you get massages and you're like, it just never gets rid of the pain, this is something that you can use on yourself. Just like that. You're going to have a lot of adhesion typically down here at the bottom. And again, you can come all the way back into the back of your neck, same thing, a little harder to get to. That's where I like to use my bar. There's also another tool called a Body Back Buddy that I will show in another video that actually works a little bit better for your neck. Another area that you can do is your chest. We talked about how it can pull forward again. You can completely do this on yourself. Right? I think you'll be surprised on how tight it is because most people don't have this worked. It's not massaged a lot. And it usually gets really tight. If you have implants and you have a hard time doing like pull-ups and push-ups and stuff, or you have a lot of upper back pain, I have found that this is really the problem a lot of the time. This is so tight from the surgery and it just pulls and pulls. And a lot of times you can get back to doing those push-ups and pull-ups without the pain. You just have to work on this fascia. This is a good way to do it. I've already shown how you can do this on your face in another video, so I'm not going to go over that. But the other one I wanted to show was your hand. So you can do just the top of your hand. You can go over here into the thumb, always putting out a stretch going in here. If you have some sort of job where you have to use your hands a lot, this can feel really good. If you have carpal tunnel, you can, I would highly recommend doing the forearms first because that's typically where it's tight and pulling, and then you can go into here where it hurts. I'm going to help release some of the tightness around your carpal tunnel. Hey, guess what? I've got lots more videos and you can check them out here, or you can go to my page and subscribe. That's the best thing to do. But make sure you guys like and comment on my videos so that I know what type of videos you want to see from me. And also, I've got lots and lots of experience on all these subjects on self-care, and I've got lots more to come. So make sure that you keep tuning in, and we'll see you in the next video.